This is Sabas in the house, and welcome to my YouTube channel where I'll be talking about surgical nursing, medicine, and everything life in between. My name is Francis and I'm a registered nurse, but I'm also an adult gerontology acute care NP student, as well as a registered nurse first assist student. This is my very first video, so I'm really excited, but I'm also nervous to launch this YouTube channel, and I hope this YouTube channel will serve a value to you guys. I am based out of Massachusetts. I go to UMass Medical School, and but I'm originally from Bakersfield, California. So go Mustangs if any of you guys from Bakersfield are watching. So let's get right into it. What is the RNFA? So RNFA is basically a registered nurse first assist. You can either be a registered nurse or you can be an advanced practice provider. So either you're a nurse practitioner, or physician assistant, but specifically with RNFA, that's specifically for nurses and NPs. So what are the different routes to become a surgical NP? So first you can be an outpatient surgical NP, so basically you're in charge of the pre-op and post-op life. You don't necessarily step into the OR, but you are in charge of the patient's pre-op and post-op life. So pre-op would entail medication management, which medications to stop or start, determining if the patient is even eligible for the surgery, and just getting the patient ready for surgery through an interprofessional collaboration with either the attending physician, the other providers on the team, and whereas post-op life, that's more ensuring that the patient is, does not develop any further complications from the surgery. Again, this entails medication management, teaching the patient about how to care for their site, making sure that everything runs smoothly, basically, post-surgery. The second route to become a surgical NP is specifically to become a first assist NP. And this is what I want to do. So I actually, my goal in my career is to practice as a cardiothoracic surgery first assist NP. I chose this route because I want to be able to practice surgery, but also see my patients in the pre-op and post-op spectrum. I think the opportunity to see the patient continuity of care through from the pre-op to the OR to the post-op is something that's really cool and really excites me, and I think it gives you a chance to treat and see your patient through holistically, because you get to see them through all those stages in their care. And to be able to do that in an acute care setting is really cool. Yeah, so to be a first assist NP, this, or what that entails, is you get to spend time in the OR. So you're assisting with surgery, and this could entail assisting the surgeon with instruments, assisting with the procedures, and even closing the surgery itself. Again, your role as a first assist advanced practice provider will depend on the state that you live in and the institution that you're going to be working in. So how do you even become certified as a first assist NP? Whether or not your intention is to become a registered nurse first assist or a first assist NP, you have to become certified, and you can do this by doing a program. Either you do it through your school, or you can do it through the NIFA, which is the National Institute of First Assist, and this is more of a national program. You don't have to be affiliated with any school to do this. I'm not sponsored by NIFA or my school. This is just information that I just want to provide you guys, and I'll insert links to both my school and even NIFA down below. It's just, you have to make sure whatever program you choose that it does cover the standards determined by the AORN. So when you're a surgical first assist NP, often the question comes up, and actually I question this a lot, in terms of what kind of track do you have to be as an NP to be able to practice in the OR as a first assist? Often the question is F&P better, or do you want to be adult gerontology acute care, as an NP? Depending on the state that you live in, again, and the institutions that you work in, it's going to determine basically which one is better for you. I specifically chose adult gerontology acute care NP just because Massachusetts more and more, and even just like the National Board of Nursing is leaning more towards billing adult gerontology acute care tracks in the OR rather than F&Ps. just because acute care tracks are trained in the acute care setting, whereas the FNP are not trained in the acute care setting. But this is not to say that you can't be an FNP in order to practice as a first assist NP, because there are many FNPs that practice in the OR. In fact, I think the director of the NIFA website is actually FNP. So, but again, it depends on where he works, you know, how much experience he has before becoming first assist certified. So those are all those factors that you have to take into account. I'll create another video actually that will go into the specific legalities and specific, you know, differences in conditions that you need to be in order to be able to practice in the OR. So just watch out for that video in the future. So how do you find the best RNFA program that's best for you? My advice is really research what field you see yourself practicing in as a first assistant. So whether it's cardiothoracic surgery, whether it's neurosurgery, whether it's pediatric surgical oncology or just adult surgical oncology, you have to be certain in terms of what field you want to practice in, because that's what you get your preceptorship in and or your residency in, and that's pretty much you're committing to working in that field. You want to make sure which state you want to see yourself practicing in, just because again, different states have different requirements, and then you also want to determine which kind of institutions you want to work in. Do you want to work in a larger academic institution, or do you want to work in a smaller community hospital? And again, it all depends on which state those hospitals are located. And then lastly, I think probably the most important thing is you want to make sure that this first assist certification will add professional value to your career, and it really, you know, that you'll be able to do your dream job doing this certification, because again, this does take time, takes money, and it's a pretty stressful journey. So you want to make sure that you really want to do this and you want to be in the OR, because if you don't even want to be in the OR and you want to be a surgical NP that just takes care of pre-op and post-op patients, then the first assist journey is not for you. You don't want to waste your time and your money, you know what I'm saying? So just make sure you look into that. So that concludes my first video. If you have any questions, leave down in the comments. I'd love to hear your thoughts, your comments, any questions. Yeah, my camera turned off. I don't know why. But again, so if you have any questions, let me know, put them in the comments below. I'd love to hear your first thoughts about my first video. If you have any suggestions, I'm always welcome to suggestions. I don't get butthurt easily, but I'm very excited to launch this, and I hope to meet you guys and keep producing videos and good quality content. Please stay tuned for my videos. It's gonna be a whole slew of different types of, not just like surgical nursing, but I'm going to cover a wide range of topics and just show you what my day-to-day life kind of looks like. So I'm excited to share my journey with you, and I hope to see you guys soon. All right, bye-bye.